Hello, I'm Ulf Pape from Germany. For over 20 years I have been working as a teacher for physiotherapists, massage therapists, osteopaths and doctors in many countries. This clip is the first part of the tutorial Thai massage combined with sport massage and manual therapy. In later parts, osteopathic elements will be added. Now in the first part, we will start with techniques for the legs and feet. The tutorials show you how to skillfully combine Western and Asian treatments to innovatively improve your therapeutic work. It doesn't matter if you work on the mat or the bench. It's important that your power comes from your center of gravity. Also important is that you make the best use of physical laws of leverage. In addition, you should train the flow of your movement. This may sound obvious, but my experience as a teacher tells me that many therapists work suboptimally in this regard. My philosophy of body work is a good therapist is also an artist and dancer. Good therapists are creative and imaginative people who combine and vary, who question critically and get a little bit better with each new day. A good therapist does not simply copy the techniques of the masters. Good therapists look over the shoulders of the masters with respect, but try to do it better. Before we begin, I'd like to say a few words about the optimal pressure when performing the techniques. Thai massage is rather a hard massage. I recommend to treat in intervals, sometimes more gentle and sometimes stronger. Too gentle massage is bad, too hard massage as well. The best indicator of the optimal pressure is that the client breathes deeply. Now we start with the first lesson. We treat on the mat in the supine position. The mat should not be too soft. The therapist should wear clothes in which she or he can move well. Before we have physical contact with our client or patient, we briefly perform a small meditation. We close our eyes, breathe deeply in and out of the lower abdomen. We try to arrive completely at the treatment situation and switch off everything else that moves us inwardly as much as possible. Our already oiled hands lay on the soles of the feet. Give your hands the order to get warm, just like in the autogenic training. This works most of the time. On the next step, gently stroke out your legs, smooth, soft and vigorous. Move your body like the water that gently and without haste conquers the hard stone. Your hands flow over and around all contours of the legs. Breathe deeply in and out with the flow of your movement. Remember my preface, a good massage therapist is also a dancer. In the next maneuver, grab your client's wrists and pull her arms in your direction so that her shoulders are pulled down in a relaxed manner. After that, your hands gently flow over your client's legs and grasp their ankles. Then pull her legs in your direction. Always remember, your power comes from your center of gravity. Your back remains straight and your shoulders are relaxed. A sensitive client feels your tension in your body and cannot relax herself optimally. Then put the legs down and stroke out them again. In the next maneuver, we perform Thai palm steps on the medial edges of the feet. Then the heels of the hands move up next the shins. We do not apply pressure directly above the knees. Then the palm steps move up to the groins. In the terminology of the Thai massage, we are on a part of the energy line Sen Kalatari. In the traditional Chinese medicine, this is a part of the spleen-pancreas meridian. And in the model of Thomas Myers, this line is a part of the frontal myofascial trains. Above the groins, where you feel the arterial pulse, you stop the blood flow for half a minute, but not if the patients have cardiovascular problems. These are contraindications. When you release the pressure after half a minute, the client will feel a warm sensation in the upper body. Then I move back to the client's feet with palm steps. This Meridian treatment relieves tension in the abdominal region and relaxes frontal fascias. The energy lines of Thai massage are similar to the Chinese acupuncture meridians and Thomas Myers myofascial trains. Even though traditional healing methods do not have an anatomical concept of fascias. I have been combining different therapies for over 25 years. My patients and students are enthusiastic about combined treatments. On the next maneuver, we perform a rhythmic acupressure with the thumbs on the medial edge of the feet. The fingers perform a simultaneous acupressure between the tendons of the toes. At the same time, we tangent on the medial edge of the feet, the spinal line from the reflexology, and with the thumbs and fingers various acupressure points. These points can significantly relieve head and neck pain, for example. Important is a point next the bifurcation between the major extensor tendons. This is the acupuncture and acupressure point lever meridian 3, one of the most important remote points against headache. Effective against headache are also all foot reflexology points of the big toe. More about this in the next lesson. With the treatment up to here, we have first grounded and relaxed the client well. We will massage, stretch and mobilize a lot. I look forward to seeing you again and thank you for your attention. See you soon.